Today, an Arizona midwife who oversaw a home birth where both the mother and infant died back in December met with state health officials. Following those tragic deaths, the state determined the midwife failed to properly monitor their vital signs and did not follow her required emergency plan. Tonight, the I-Team's Bianca Bona reports that families who worked with that midwife want her license revoked and want the regulators who allowed her to practice to be held accountable.
I had had a hospital birth with my first daughter, really wanted a sense of more control.
So in 2020, Heather Flowers opted for a home birth, working with midwife Sarah Kankowitz.
I trusted her. She's supposed to be the professional, and it just wasn't the case.
Flowers' baby was 11 pounds, and she had an extreme laceration. Her birth was botched.
There's not one day that goes by where I don't suffer some form of a consequence.
Flowers filed a complaint against Kankowitz with the state's Department of Health Services. An investigation found multiple citations. The midwife didn't check vital signs enough, downplayed Flowers' laceration, and didn't take her to the hospital when she was supposed to. Flowers' complaint would be the first, but not the last.
Why are we allowing this to happen?
After Kankowitz received multiple civil penalties for failing to submit required paperwork for more than a dozen patients, in which the state gave her huge financial breaks, another complaint resulting in citations came in 2023, and in December, tragedy struck.
There was no blood pressure check, no oxygen level, no anything.
Parker Terry's pregnant wife Jordan and their newborn baby boy Mac both died after a home birth that Kankowitz oversaw. Records again show Kankowitz failed to do necessary vital checks and didn't enact her emergency plan in time, even after Jordan's lips turned blue. Parker himself ended up rushing his wife and baby to the hospital, but they didn't survive. Jordan had a uterine rupture.
The processes in which you research a midwife are incredibly difficult.
The complaint stemming from Jordan and Mac's deaths resulted in 5 citations, but the state's documents don't tell that full story. If a future family read the report, they would never know that they died.
Do you believe that there should be more transparency when it comes to the information that's publicly available to families?
Well, of course.
Will Humble is the former ADHS director. He was with the department when they expanded the scope of practice for midwives, allowing them to perform VBAC home births, a vaginal birth after a cesarean section. They're considered higher risk, so he said they established strict criteria for midwives, criteria Kankowitz did not adhere to in Jordan Terry's case.
If the state agency isn't doing a good job overseeing the midwives, those risks go from manageable to really, really bad.
In March, the state issued a notice of intent to revoke Kankowitz's license. She's been allowed to practice since, even posting online suggesting she will continue her practice privately. On Wednesday, she and the state had a settlement conference, but a DHS spokesperson declined to share the results of that meeting, only saying they are in talks about potential settlement terms.
What goes through your mind when you learn there were people that were trying to alert the state about Sarah and her practice years prior to your interaction with her?
That if the state would have taken him serious, that my wife would still be here.
And we have repeatedly asked DHS why Kankowitz's license was not revoked previously. We've also requested a sit-down interview. That request has been denied. Bianca Bono, 12 News.
All right, Bianca. A big day at the state